All right, so the nasal and oral cavity. And who's heard the word cavity before? Tell me about this cavity thing you've heard of.
Get those all the time.
It's a hole, yeah, it's a hole, right? So we're saying the same thing here, right? Literally the nose and the mouth are just holes in your head, right? Where things can come in and out of. It's an opening, it's a portal, it's a depression. Right, so, and the nasal and oral cavities are mucus filled, meaning what about them? What's an adjective we could use to describe them since they have mucus inside? Mucus is what?
Bacteria.
Can catch bacteria for sure. Simpler than you think. The opposite of when it's raining out.
Dry.
Yeah, there's dry and wet, right? So, yeah, right, so mucus is a wet thing, right? So, without mucus, your cavities would be dry. And it also has cilia, which was a vocab word from last week. Who remembers what cilia was? Or were? They were found in many eukaryotes, protista eukaryotes, as well as prokaryotes like eubacteria and archaea. Anybody? If I do the magic fingers, does anyone remember cilia then?
Jazz hands?
Jazz hands, yeah. Anybody?
Isn't that like what animals use to move?
Yeah, right, with small organisms, right, used to move, like little hair-like structures. So our nose, as many of us can see if you look in the mirror, we have hairs in our nose, right? We have little structures that are designed to gather and capture things floating in from the environment. The nose and the mouth also warm air, right? So who's had that experience of taking a really quick breath on a cold day? What does that feel like? Is it pleasant?
No.
No, right? You feel like your lungs kind of seize up, right? So it's this idea that we want to condition the air before it gets to the delicate lung tissues. Now, as for our neck structure, the pharynx, we're going to do that in dark blue today, our pharynx. And you're still coloring the words, sir. Yes. Oh. I won't say it to you. All right, so the pharynx is the superior region of the throat. We have this word superior, but what is it when something is superior?
Bigger than something.
Or it could be bigger.
Power.
First, we talked about superior parts of the brain.
That can go like.
If I say cerebrum, like you said before, where is that in reference to the rest of the brain? At the top, right? So the superior means at the top of, right? So it's the top of the upper throat. And the pharynx is the place where the nose and the mouth come together, where those two cavities meet. It's the intersection of the highway. And it connects the nasal and oral cavity. We all have lifetime evidence that the nose and the mouth are connected. Who can think of an event in their life where something has gone from your mouth out your nose?
Milk.
Ew. Yeah, go ahead. Yeah. No, do you tell me?
Okay, so like when you choke, like when it doesn't like
All right, so maybe you feel air or moisture or things like move up from the mouth to the nose. What about the whole thing? Has anyone ever been drinking somebody and then laughed? Drinking something, sorry. Yes, no, what happens?
Well, that's what happened to Yelena in math class. She was drinking Gatorade, and she started laughing, so it came up through her nose.
Came out her nose, right? So there's evidence that these two tubes are connected, right? They went through her mouth and then out her nose. At the end of a cold, when you've been really sick and you've had a lot of mucus, has it ever had that experience of post-nasal drip when you can feel the mucus dripping down your throat from your nose?
Yeah.
Ew.
Right.
Yeah.
Doesn't that ever happen? It's like you have like mucus and then you know when you spit, I don't know.
Yeah, right. And like, can you like sniffle your nose and spit it out your mouth?
Yeah.
Yeah, right. These two tubes are connected by this area, the pharynx, so we can transfer fluids between the two. Right, so they are a connection between the two. All right, nice connections, folks. All right, so let's move on to the next thing. All right, so in our lighter blue, we have the epiglottis. All right, so in our lighter blue, the epiglottis, and this is a flap of cartilage, a type of tissue that we're going to learn a lot about in chapter 8. It's a flap of cartilage that redirects air. What is it when you redirect something?
reset, like
make it go somewhere else.
Make it go somewhere else, right? So it's like if you redirect traffic, yeah, good teamwork between the two of you, thank you. Right, it's either gonna send things to the trachea or to the esophagus, right? If it's air, we'll send the trachea to ultimately wind up in the lungs. And if it's something solid or liquid, we'll send it down the esophagus to the stomach. Now, is the epiglottis always on point? No, what can be the result?
You swallow your own saliva, and then it goes into your lungs.
All right, so perhaps some small amounts of liquid from your body can wind up in your lungs. But what else? What else happens sometimes? You're eating things, you're shoving it in your face really fast like a wild animal.
It's not hard, to go down.
And so maybe you can get stuck if you don't chew it enough. Is it true that sometimes you choke?
Yeah.
Yeah, right? And then what's happened there is the epiglottis has misdirected those food or drink particles. Right? They've gone down the trachea towards the lungs, and then your body has to forcefully eject them.
How come it hurts?
Now what about the opposite? What if air goes down to the digestive system, down the esophagus and the stomach? You burp, right? So you can expel gases that way too. So the epiglottis does an effective job most of the time, but like any machine, it's going to have its errors. All right, so just inferior to the epiglottis is our larynx. We're doing that in our darker green today, so using your dark green pencil. All right, so doing our larynx in our darker green pencil today. So this is a muscular cusp, and cusp is an SAT word, so it might not be one you're familiar with yet. A cusp is like a transition point. It's a point in between two things. A doorway is a great example of a cusp. Or having, a 79 on a test, right? You're just under the next grade, right? So that is a cusp. Or if you are at the boundary line between two towns, right? You're at the sign where it says like, welcome to Mattapan, welcome to Dorchester on either side of the street. That is the cusp between the two neighborhoods. All right, now this muscular cusp, it can contract to constrict the volume of air traveling through the trachea, through the windpipe. And this is what allows us to make sound, what allows us to vocalize. So, of course, what's the everyday common name for the larynx? Something you've heard before. Your vocal cords, like your voice box, right? And remembering that muscles they come in strands, right? They're like rope-like. All right, so we're going to compare our voice and our larynx to some woodwind instruments. Who can tell me the difference between a flute and a tuba? All right, so saying tuba makes a lower sound, whereas the flute makes a higher sound. Tell me more. What do these objects look like in comparison to one another? Bigger how? In what way? Bigger like longer?
No, big like
What do we call it, the measurement of a circle?
Diameter.
The diameter, bigger in diameter. Great. So, and nice teamwork there, folks, right? So instruments that are slim, right, make high-pitched sounds, and instruments that are wider in diameter make low-pitched sounds. For example, if I constrict my larynx, I can make a much higher sound because I'm forcing much more air into a small space, right? Or I can dilate my larynx, I can open it up, and I can make a much deeper sound because it's a much larger space in my throat, right? So we have control over this muscle and the kind of sounds we're going to make. And is this also, do people have different ranges? Are some people more naturally a higher, more constricted, a smaller constricted throat, right? There's still variation, like they can still adjust to the way they sound. But there is, of course, some limitations to that. All right, great, let's move on. All right, cool, so next up in our lighter green, we have the trachea. And the trachea's common everyday name is the windpipe. Folks have heard that one before. Now you'll notice that the trachea, just like the larynx, is also muscular, meaning that it takes muscles for this respiratory organ to be functional. And just like I talked about the nervous system before, there's an intimate relationship between the muscular body system and the respiratory body system. Alright, so this muscular passageway connects the superior, the upper respiratory tract, to the lungs, and it uses an action known as peristalsis. And peristalsis can be used to expel any foods that have gotten down to the trachea, gotten down into the windpipe, which of course are dangerous. They cause an obstruction of air. You can't breathe, you die. If I were to say that peristalsis was very similar to the movement of a flag in the wind, what would you say back to me? Or what would you show me? Sure, if I were to say that peristalsis is the same kind of movement as a flag in the breeze, what would you say about it or show me? Alright, so he's kind of doing this, right? Is there an animal that moves like this?
Snake.
Snakes, right? So it's a movement known as undulation, or to be ungular, right? So the way the trachea works is it's going to slowly massage and try to push those contents back up and through. And now that you are all trained in first aid CPR through health, I know that if I'm in a dangerous situation, choking, I don't have to rely on my own peristalsis. Yeah, in their health class, they all become first aid and CPR certified.
I have it.
Yeah,
I was joking.
they'll get the cards too. They usually come to like
We're not certified.
We're trained.
We just
Oh, they didn't do the full cert? Okay. Oh, they make you test at the end.
gotta pay.
Good enough. You still better rescue me if I'm injured and dying. Alright, so
Bring your receipt.
Alright, so in our yellow next, grabbing our yellow, we've got our bronchial tubes. So our bronchial tubes are a branching network of tubes that distribute air throughout the lungs. And the main word here is branching. This idea that they spread from one branch to smaller branches yet, right? Just like we go from like an arm to fingers, there's a branching that happens here. And we can start to think of this metaphorically and thinking of it as the trachea as being like a highway and air molecules as being like a car. They're all going to travel down the highway, all the air molecules, just like the cars would travel down. And then, yes?
What color is the next one?
I think what a logical succession of colors I generally use, the Roy G. Biv formula. So we've done green and then yellow, orange will be next. Yeah, I'm hoping folks will start to make those connections. Right, so our bronchial tubes would be like the streets off of the highway. Right, the trachea is the main avenue, and then you get off the highway, off the exit, and you start driving through the streets. Right, so these bronchial tubes.
Is this yellow?
Yes. Alright. And if they got reversed, it's not, it's not the end of the world. Alright, so our trachea, again, our trachea is like this highway where all the air travels through, and then the air gets segregated out into the many branches, into the bronchial tubes. And has anyone ever heard of the disorder of bronchitis? Never ever had it? A lot of kids get it, right? It's awful. Your bronchial tubes get full of mucus, and you can't get air through your lungs. Like, you can't breathe. So you spend like your whole time like hacking and coughing and trying to get all this stuff up and out. All right, so at the end of every bronchial tube, is an alveoli, and we're doing that in orange today. Can anyone read that number for me? 10 to the 6 power, aka? How many?
I'm guessing.
How many zeros will there be? 6. So we've got a digit, a comma, some zeros, a million, right? Right, so great, we have a million small air sacs here at the distal end of each bronchus. So we have a new vocab word that's common in science, distal. Distal just sounds like what? Distal,
Dishes.
I don't even know that one. Something that's far away. Distant. Right, so right, so the end points of each bronchial tube are these alveoli, these small gas chambers. and each of them is surrounded by a capillary, which is going to be our next vocab word. And we want to think of our alveoli as being like small balloons, right? So every time we inhale, these little balloons inflate. And what's our visual, physical evidence that this is happening, that the alveoli inflate when we inhale? What physical, visual change do you see in your body when you're breathing? Yeah.
Like, your chest is bigger, like,
Your chest expands, right? So we know, we have evidence that something in our body is holding air, right, as we inhale because of the expansion of our rib cage. All right, so we have our alveoli. Each of them is surrounded by our next vocab words, which we're doing in red, our capillaries. I'd like you to notice the prefix here. What is the first three letters of this word?
CAP, capillaries.
Just like my name. And what is a cap?
That's all.
Something you cover something.
Something you cover something with. Awesome. Right, so a capillary covers our alveoli. Right, it's a cap, it's on top of, it's around our alveoli. And these are microscopic blood vessels, very small, very thin. And their job is to exchange gases. And I have this needs to be swapped out, folks. Instead of osmosis, that just say diffusion. I apologize. I meant to change the last period, I forgot. That blood vessels that exchange gases via diffusion between the alveoli and the bloodstream. So we've got a lot of statements here to kind of take apart. For one thing, we need a refresher on diffusion. What was diffusion again? Spreading of molecules, or most anything, right? So we know that these gas molecules, they were in a really high concentration in our lungs, and now we're going to spread them out into our bloodstream, right? They're going to diffuse through the capillary, or through the alveoli into the capillaries, and then to the blood. Someone in the last class had asked what via means. Are we all cool with that? Or is it, right, so yeah, like via means from, to, or for. Or exchange via osmosis, or via diffusion, thanks. Via diffusion between the alveoli and the capillary. And we want to think about the alveoli, like any membrane, is a solid object. So how is it that gas is getting from the alveoli into the capillaries and then the bloodstream ultimately? What do you think is happening there? So as the balloon, as the alveoli expand, what happens to the density, the thickness of its walls? Just like a balloon, the density is going to decrease, right? So when you blow a balloon up and it goes from being a very solid, opaque to a much more transparent, as the alveoli stretch, there's enough space in between the tissue for the oxygen to diffuse out into the capillaries. And you guys will see that in your diagram when you do your reading and your homework tonight, which I say you clicked when you did. All right, so we're ready. All right, 2 more. It's a 10-word day. And in our brown today, in our brown we have our intercostal muscles. All right, let's take a look at this word and see if we can gather some meaning from it. What about the prefix inter? What does that mean? Inside of. Or what about coastal? When you think of the coast, what are some of the things you think of at the coast? You think of water, you think of the beach. What's happening between the water and the beach?
They're interacting.
How?
The water goes into the like that. Up top.
Yeah, go for it,
Like
Diana.
the edge.
All right, Diana, what do we call that motion? Of like you see the water come in and then it comes back out. It's doing this.
Waves.
Waves, right? So when we think about coastal, think about a wave or a wave-like movement. Help her out, Eddie. So we're thinking about a wave-like motion that's caused by these muscles, and each of these muscles is in between each rib of your body. What these muscles do is when they contract, when they shorten, when they tighten, they compress your rib cage. What is to compress something?
Pushing.
To push in, to crush, right?
I'm not a relative.
So every time you exhale, every time you breathe out, and you're feeling it, every time you breathe out, these muscles are squeezing your ribs close together. Speaking of ribs, those of you who are vicious flesh eaters and eat ribs, what you're eating are these muscles. You're eating that meat in between each rib is an intercostal muscle. It's the muscle the animal used to breathe before it was killed for your dining pleasure. All right, now that alone doesn't count for all of breathing. We also need a muscle to cause the inhalation, and that is our diaphragm. Oh, that's just your normal pen, pencil, whatever you're using today. All right, so we have our diaphragm, a large medial muscle. Once again, a word that is slightly familiar. Medial kind of sounds like median. What's a median?
Medium is
It's in the middle of, right? Yeah, median. So we're talking about a muscle that's in the center of the body. It's in the median, and it's inferior to the ribs, meaning what? Where is it in comparison to the ribs? Lower at the bottom of. Excellent. Right. So it's in the middle of the body, underneath the ribs, and when this muscle contracts, what it does is it pulls down and stretches so that the lungs have more volume. They can take more air in. And you guys mentioned before that you've seen that increase in volume as you're breathing, right? As your rib cage expands. All right, and now that we're at the cusp of our notes and our activity, we're going to do a little breathing exercise. So in order to have this be the most effective, we're going to have everybody get into the best breathing position possible. So what you're going to do is get your bottom all the way back into the fold of the chair, just like this gentleman did here. And then you can just use the back of the chair to kind of lean back a little bit so your rib cage falls open, your arms kind of hang at your sides. All right, great. So looking good over here, right? So yeah, we got some good modeling in the back, very nice, right? So we got some space here. What we're going to do is we're going to do considered an average rate of breath. And we're going to do it in what's considered to be the most natural way. So we're going to be inhaling through our nose and exhaling at our mouth, each to the count of 5. So we're going to do 5 seconds of inhaling and then 5 seconds of exhaling. So I'm going to cue you non-verbally with this. So I'm going to use my fingers to count our breaths as we go. So getting into our position, so our back is arched a little bit, so our lungs have the most space to fill. And we are going to inhale for the count of 5 through our nose. Inhale through the nose. And exhale out the mouth. Inhale through the nose. And exhale out the mouth. Inhale, nose. Everyone's participating, of course. Exhale out the mouth. Not a time for commenting or looking around. Inhale. And exhale out the mouth. We're doing 2 more cycles. Inhale.
What if you're lightheaded?
And exhale.
Yeah.
And just, let's do a couple of our normal breathing, how you would normally breathe. All right. Tell me about some of your experiences.
I'm lightheaded.
All right. All right. So, as we more deeply oxygenated our blood, did we have a shift in consciousness? Did our perception of reality change? Yeah, right. For one thing, we're not normally in the habit of controlling our breath, so it's odd, right? It's a little bit stressful almost. But after the 10 breaths, though, how would you best describe your state of being? Would you say you felt better or worse after the breathing? Like happier or sadder or more calm or less calm?
I have a headache.
Yeah, you might feel a little buzz, right? But generally you should feel more calm. Going back to Oprah's statement and our quote there, there's a lot of research around breathing, and if you're really angry at somebody or something and you take 10 deep breaths like we just did, you're so focused on that and on the oxygenation that you tend to forget your problems. Like you come out of the other end of this feeling a little better. So I invite folks the next time you're feeling frustrated to do 10 full breaths. 10 inhales, 10 exhales. All right, I'm going to shut the lights so you can see this a little better. I've done 2 things here so you have the best access to the learning. This is the diagram that most commonly appears on the MCAS. It's also similar to the one in your textbook. However, it's incomplete in reference to what they've asked you on every MCAS over the years. This one has all the structures and all the colors that they've ever asked about. So it's a more complete representation. So either using page 241 to trace this object or just drawing it, it's the usual routine, right? We're going to draw and color these things. In about 10 minutes, I'll review it to make sure we've got the right parts in the right place, and then we'll do our exit card and we'll be out the door.
Yay.
All right, so have at it, folks.
So what are we doing? Listen, page.
So we're drawing this?
Indeed.